So in this video, we're discussing the one big difference between cash and insurance physical therapy. But before we get into that, I want to take a step back and tell you a little bit about myself and as to why I feel like I can talk on this subject. So I currently own a cash-based physical therapy clinic called Performance Redefined. And I actually opened it 1 month before starting physical therapy school. Now, I often get asked, why did I start that before school? And really, one of the big principles that I like to preach to physical therapy students and to physical therapists is to always set your future self up for success. And so for me, I knew that I wanted to go the cash-based route. So opening before school allowed me to slowly build a clientele by working part-time and over 3 years build a business. And what that allowed for was a smooth transition. So day one, I came full-time into my clinic and everything's been going great since. Now, with that being said, I often get asked by patients, by students, by physical therapists, what is the difference between cash and insurance? And now there are logistical things, the most obvious being cash pay versus insurance pay. But there's a lot of rules and regulation differences and things like that. But what I've found is that I've gravitated towards one specific analogy to really help people understand. And that one analogy is that cash physical therapy usually solves the source of the problem. And in the insurance world, they often solve or try to fix the symptom. So it's a source versus symptoms approach. That's what I want to talk about in this video to help you understand the difference between the two. So when it comes to understanding the difference of this approach, we first need to address what is a source and what is a symptom. Now, I do want to make a quick disclaimer and say that throughout all of this, I'm not trying to knock any insurance-based physical therapy clinics or physical therapists. There are amazing ones, but what I'm going to talk about is the difference from a freedom and flexibility and mindset perspective, all right? So when it comes to symptoms versus source, we can use an example. If a patient comes in and they complain of knee pain, often the knee is the symptom and the hip or the pelvis or the rib cage are the source. Now, there are definitely other circumstances. If someone just had a total knee replacement, then that's a little bit different. But from a normal person walking in, if the knee is the complaint, it's often the symptom. So when it comes to cash versus insurance, in the insurance world, you usually have to stay around the knee. Yes, you can do some hip stuff. Yes, you can do some ankle stuff maybe, but straying up to the rib cage or the shoulder or the neck might not work. And I get it. If you are trying to get reimbursed as a clinic and the insurance person behind that computer is reading that this person's here for knee pain and you're doing right shoulder exercises, they might not pay you. So it's harder to stray away. Conversely, in the cash world, we have the freedom, the flexibility, and the luxury of saying, hey, Mr. Jones, your knee is hurting. What's going on at the pelvis? What's going on at the ribs? What's going on at the neck? What's going on with your gait and all these other things that we can really use to connect the dots? And it doesn't matter from a pay perspective, right? So what does this source versus symptoms ultimately mean? Well, it really means short-term results and long-term results. And again, not that you can't get long-term results in the insurance world, but think about it. If you're a physical therapist in an insurance world and you don't get that person long-term results, they feel a little bit better, but they end their sessions and they don't really feel any particular way, you still have a long line of customers coming into you, right? Conversely, in the cash-based world, long-term results is the business's livelihood. We genuinely want to create a life-changing result for someone. Why? Well, ultimately, they're coming into here paying out of pocket because they want a very specific result. And if you're a physical therapist in the insurance world, you know a lot of patients that are on your schedule are not coming in there motivated. They're not wanting to get better, right? It's something that they have to do. In the cash world, this person's coming in because they want to. And with that, they want and expect a certain result. So the pressure is a little bit higher in the cash world to create a life-changing program, to create life-changing results, aka long-term results for that patient. And if we don't, it's hard to maintain a business, right? Because if that person doesn't get long-term results, are they going to tell their friends? Are they going to tell their doctor on their next visit about the clinic? Probably not. So the pressure and the demand is a little bit higher. But in my opinion, that's a good thing, because what it does is it constantly challenges you. Make sure that you don't just take a back seat, and make sure that you don't do the same thing with every single person. Because if you do the same thing with every single person, you're not going to get that long-term results. Everything needs to be specific based off that person that's in front of you, not the condition, right? So to me, it's a good thing. The end result of that, the end result of the specificity, leads to intent and fulfillment, in my opinion, that are much higher in the cash-based world. Why? Really because of everything that I just said. Yes, the job requires it, but it's fun throughout the process. And sometimes when we lose that fun and we lose that motivation, we lose that drive because we're just seeing so many people and the end result doesn't matter as much, it can be really easy to feel burnt out. And in my opinion, that's part of the problem in the insurance world. Is just, it's the same over and over, and learning goes down and burnout really increases. So that's how I like to view one of the biggest difference in the cash and insurance world. There are amazing therapists in both. There are amazing businesses in both. It's just easier to fall down that burnout road when it comes to the insurance because results aren't as a priority and time is significantly less, right? And so a lot of times in the insurance world, if you want to get that result, you might not have enough time, right? That person might have 8 weeks and you might need 12. And so it's hard to see that all the way through, to feel that fulfillment, to create that life-changing result. So hopefully that's helpful for you to understand a difference more from a practicality standpoint, not from a logistical standpoint, from a day-to-day standpoint, but an overarching theme and principle that I try to raise my own clinic standard to create that life-changing result.